Have you ever taken antibiotics for your UTI? You may be surprised to learn that more than half of respondents to our UTI quiz said they haven't. Antibiotics are the most commonly prescribed treatment for UTI. One study found that 85.7% of UTI diagnoses resulted in a same-day prescription for antibiotics. Antibiotics work by killing and/or slowing the growth of bacteria that is suspected to be causing the UTI. The duration of the antibiotic course can vary, but it is usually 3 to 5 days for an uncomplicated UTI. Sometimes doctors will prescribe longer-term antibiotics for recurrent or persistent infections. We often get questions about which antibiotic someone should take for a UTI, but it is not as simple as there being a single antibiotic that is the most effective for all UTIs. Different antibiotics have different mechanisms of action, meaning they work in different ways. Some are bacteriostatic, which means they work to prevent growth and reproduction of bacteria. Others are bactericidal, which means they kill the bacteria, often by inhibiting cell wall synthesis. You might have heard the term first or second-line antibiotic. First-line antibiotics are generally accepted by the medical authority of a region as the most likely antibiotic to result in successful treatment, and are considered first. Second-line antibiotics are considered if the first-line antibiotics don't work or are unable to be taken by the patient. The antibiotic prescribed can vary depending on antibiotic resistance patterns in a region, a patient's individual history with the antibiotic, results of a susceptibility testing, or other factors. For these reasons, antibiotic prescribing is not a one-size-fits-all solution. There is much discussion amongst UTI experts regarding the optimum duration of a course of antibiotics. It has been suggested that the typical 3 days may not be long enough and may increase the chances of recurrent or chronic infection. For longer-term antibiotic treatment, potential side effects become even more important to consider. What are your thoughts on antibiotics for UTI?